and it's really nice to see a lot of familiar faces from the islands. I just got back from the Marshall Islands last week, so I just said, hey, long time no see. um, my name is Amy Chutaro. I'm the Executive Director for the Pacific Island Health Officers Association, or PIHOA for short. We're actually based here in Honolulu, so it was really a great opportunity to spend some time to come here and speak a little bit about the work that we do in the Pacific, as well as some of the overarching challenges that we face. So got an email from Emily and others from ACGI to AGCI to come in and speak a little bit about this. Now, there's a lot to cover, and so I really struggled to try and find something that would sort of give a good sort of overarching view to everything. So forgive me if I'm going to sort of go through a lot of these rather quickly. And I thought, to be honest, a picture is worth 1,000 words. So you'll see that this presentation has quite a lot of visuals, because I know for most of you, you're from the islands, but there's also some that haven't been to the islands yet. So this is a way to maybe sort of provide a good context for all of us moving forward. So my presentation is really going to touch on two things. One, sort of giving a context of the Pacific and the health challenges that we face, and how that then provides some information for your discussions for the rest of the week, but also then talking a little bit about PIHOA and what we're trying to do to help address some of these health challenges. So we were established in 1986. We were established through the health officials of the 6 U.S. affiliated Pacific Islands, so we call them USAPIs for short. And this includes American Samoa, Guam, and Guam and CNMI, the Commonwealth of North Mariana Islands, as well as the Federated States of Micronesia, Republic of the Marshall Islands, and Republic of Palau. We are a 501c3, and we were originally chartered in the CNMI, but now more recently here in the state of Hawaii. And we have 3 offices. So our headquarters is here in Honolulu, and we also have offices in Guam and Palau. We also have staff that are co-located within the health departments in some of the islands, depending on their specific issues and their needs and their requests to us. Very, very quickly, a lot of our work revolves around advocacy, particularly, at least here in Hawaii, our relationship with the U.S. federal government. So we work a lot to advocate and support the needs of the Pacific with our regional partners out of the mainland United States, but also with our federal partners as well. So recently, we've been asked to be part of the CDC's State Tribal Local Territorial Subcommittee, which is an advisory committee to the CDC director. So that has been a really great opportunity to try and advocate for our islands at the higher level leadership within CDC in particular. And we're also part of the Micronesian Islands Forum, which is the governors and presidents of our islands. So a lot of the issues that are raised with our federal partners in discussions in our board meetings, we are then able to advocate even further at the executive level of our leadership in the islands. And we have been recently endorsed as what we call the triad of partners in the Pacific, with WHO, and also with the Secretary of the Pacific Community. So the 3 of us work very much hand in hand in addressing a lot of the health issues that we share in common to address and support. And last but not least, and I'll touch a little bit on these later on, but we are part of the partnership around, for example, the Non-Communicable Disease Alliance, MANA. We're also part of the Pacific Public Health Surveillance Network, which is a WHO SPC initiative, as well as the WHO Pacific Health Security. So I'm going to touch a little bit on that when I'm talking about the health challenges. And I think more recently, one of the things I wanted to highlight is that we have been getting some traction, particularly with our federal partners, to address some of the chronic systemic health issues that we're experiencing in the Pacific. And so we're trialing out this model, and that is that we're getting some federal, what they call field assignees, to actually come and work in region. So not just embedded in the health department, but also embedded with us at PIHOA, which enables them to work regionally as opposed to just in one health department or within one program. They can actually work more multidisciplinary sort of approaches to technical assistance. They're more easily deployed out to the islands. They don't have to come all the way from Atlanta. I mean, it makes things a lot easier in terms of coordination. So far we have immunization, public health advisors, chronic disease epidemiologists, and also a communicable disease epidemiologist as well so far. So we're hoping that we can get more folks into the region to assist. So our primary mission is multifold, and to kind of bring it all together, ultimately where we stand is what we call health system strengthening. We look at the whole broad range of health systems and where can we provide sort of that holistic, whole of ministry, departments of health, but also whole of government approach as well, because some of the issues that we're seeing with regards to our departments and ministries of health functions are impacted by the larger government institutions and governance structures, et cetera. So we work very much broad-based with the health departments and the ministries of health, but also with other government departments as well. Right now, in accordance with our current strategic framework, 2018 to 22, that was recently endorsed by the health officials of the islands, we're focusing on these core areas. One is ancillary support services, right now primarily focused on lab strengthening, health information management systems and surveillance, performance management and quality improvement across the board, human resources for health, strategic engagement, coordination and advocacy, leadership development, as well as regional policy making and more. And this one's actually quite new to us in the last year or so, and that is Pacific Health Security. And I think Dr. Nasser could talk a little bit about that too. So where do we work? I think some of you have already been seeing this over this last morning, and my apologies if I repeat this, but when you look at sort of the scale of the region and the challenges that poses in terms of logistics and providing appropriate TA and relevant TA that is context appropriate to that particular island and those cultures, it is never always an easy task to try and convey that to a lot of our partners who don't operate in the Pacific, particularly some of our federal partners. And so we often start with, again, a geographic map of, okay, here's where we are, and here are we in terms of relation to Hawaii or California, for example. And if you were to superimpose the continental United States, from Florida to Washington State, you could sort of roughly guesstimate that American Samoa is sort of on that tip of Florida, or maybe a little bit beyond that. And of course, Northern Marianas, CNMI, that is way up here. But it's actually a little bit more actually than the continental United States. And then of course, we're talking about almost 5 international time zones. So when we have our meetings and when we have our calls, we really have to be cognizant of the time zones. And then trying to link the Pacific with our federal partners in DC and in Atlanta. Our workday starts at 7 o'clock in the morning and then it ends at 9 o'clock, 10 o'clock at night, just because we have to be able to work through all those different time zones. And I'm sure Nasser can agree with me working out of the Manila office as well. Now, there is a tendency, unfortunately, to sort of lump the Pacific as sort of one homogeneous group. And yes, to a very large extent, we share a lot of common cultural values, features, practices, etc. But at the same time, within that, there's a lot of diversity and there's a lot of things that are not similar. And I think those unique qualities and values are sometimes lost, when we talk about what are some initiatives or what are some regional work that we need to be doing in the Pacific. And it's really important for us as PIHOA to try and provide that more specific context, to really advocate for those unique features and unique values that are specific to, let's say, American Samoa versus, Saipan, versus, Palau. And I think, when we're talking about public health, when we're talking about people building community resilience, it's those cultural values, it's those unique sort of circumstances that we want to make sure get heard in a lot of these discussions. So here, just very quickly, you have YAP in the Federated States of Micronesia. You have some islands that are still very traditional. In fact, they don't allow traditional wear. So when I did my public health work in some of the outer islands, I had to shed all the the clothes And I had to because it happened to be the Chief's Island, so I had no choice, and I needed to be respectful of that. Here is Samoa. Here is the outer islands of the Marshall Islands. This is in Pohnpei, a Sakau ceremony. This is in Guam, and this is in Saipan. So already, just in that view alone, you can see sort of a diverse array of experience, of lifestyle, but also exposure to the outside world, either through the United States or in other exposures. And that can vary very, very widely across the Pacific, depending on where you're from. Again, another thing, island environments tend to sort of lump that together in terms of the impacts of that. But to be honest, when we're talking about atoll environments versus high island environments versus low island environments, a lot of that have actually different implications on sort of impacts, how to address issues, logistics. I mean, a lot of them are very different in many ways. So what I wanted to highlight here is that here you have Guam, which is I guess it's called not quite a high island, but sort of in between. And you have this urban sprawl. You have quite a diverse array of services that are provided. You have then here, which is Palau. This is Koror, and I believe the hospital is somewhere along here. And these causeways that go between different islands. Then here you have, I think this is one of the outer islands of Chuuk. This is an urban area, Madro, in the Marshall Islands, and this is sort of the aerial view of Madro. And if you can see here, there's not much greenery. And then, of course, you've got Colonia, Pohnpei. So again, there's sort of a diverse array of experience, of infrastructure, of how the islands are, and some of the availability of services, as well as impacts on logistics as well. So, and I'll talk a little bit more about that, but just to give you sort of a view to this. And then we have other, what I call vulnerabilities that sometimes get lost in some of the discussions when we're talking about regional initiatives in the Pacific. One is obviously, and most of you know, and me being from the Marshall Islands, the historic nuclear legacy and the impacts on health that currently still even exist. Some of the highest concentration of certain types of cancers are specific to the Marshall Islands. And some of the highest rates of leukemia and thyroid conditions, for example, are some of the highest in the world globally. Then you have issues, again, around urbanization, uncontrolled population growth. What does that mean in terms of health and sanitation, sewerage, and the impacts on health because of this overcrowding situation that we have in some situations. This is Ibai, and right next to it is the U.S. military base of Kwajalein, which is what I call Pleasantville, or my version of Pleasantville. But right next to it, which is a 15-minute, 20-minute ferry ride, you have what we call, unfortunately, it has a name, which is the slum of the Pacific. And it is quite apt description because most of the houses are made out of tin roofing materials, plywood that has been drifted, that has been collected, that's been drifted, through the ocean. And so these islands are extremely vulnerable to a lot of environment-related infections and diseases and other conditions. Here is the outer island of Chuuk that was recently impacted by Typhoon Maysak a couple of years ago. Now, yeah, it should be a couple of years ago now. And then you contrast that with Saipan and the new mega casino structure that is, well, this was actually last year, but now it's got gold domes and it's got marble arches, and you go in there and it's just like, whoa, am I even in the Pacific? So again, there's such a diversity here of issues that we want to try and touch on. Is historic vulnerabilities, the current sort of urban sprawl, overpopulation issues that we're seeing, and of course, ongoing commercialization of some of our islands that bring in a lot of folks that are coming in from outside. And then we talk about health systems specifically. So here you have the Koshrai Hospital ER. So this is their emergency room. They don't really have much. All they have is pretty much for hydration, that's it. This is in the Marshall Islands. Now these have been resolved, but at that point, these are the biohazard bags right behind the hospital. And here, when we're talking about climate change, sea level rise, coastal erosion, this is in Madro, Marsh Islands, actually right next to where I grew up, about 5 minutes on the right, walking distance. And this was a huge graveyard that over time just kind of fell into the ocean. And then we're talking here about Guam Memorial Hospital, as you all know, or some of you are from Guam. Half of it has been, well, one side of it has been condemned because the infrastructure is so old that it's no longer usable. What we're seeing now, because the tuna fisheries in Atlantic are now pretty much fished out, we're seeing now a lot of the commercial fisheries are coming into the Pacific. So when you're talking about folks that are coming in and cycling through, and the mobility of populations in the islands, you have people coming in from Indonesia, Malaysia, China, mainland China, Taiwan, Russia even. And what does that mean in terms of port security, for example, and port surveillance? So I just want to hit home here. If we are impacted by climate change, where do we go? How do we escape? What do we do? It's one thing to talk about climate change adaptation, but at the end of the day, it really comes down to human survival at a particular event in time, and how do we deal with that, and how do we address that in a long-term way? And this is just an example of a humanization run in some of the outer islands. You cannot go into the lagoon, right? The big ship cannot go in there. And you have all these communities here that have to get, so cold chain management, they have to go by little boats to be able to deliver some of the vaccines. So these are just, again, more examples of other vulnerabilities with climate change, disaster. And again, these are real pictures that I've taken, in my travels. And again, this one here is actually right next to my home in Madro. So disease burdens. So if seeing that context and seeing sort of diversity of some of the issues, it does not come too much of a surprise that on the disease infection side, we do have quite a significant amount of challenges. And what we're seeing in the Pacific is what we call this duality of disease burdens of both non-communicable and communicable diseases. And so in some ways, we're sort of a hybrid of the developing world health disparities and the developed world sort of lifestyle-related health conditions. And that's what we're seeing right now, is sort of this milieu of issues that are kind of all coalescing together in these last 10 years. And so just to kind of give some thoughts here, with regards to communicable diseases, I can go through a lot of data, but I just want to highlight one, and that is with regards to TB. We have one of the highest incidences and prevalence of TB globally. We're one of the top 10. And so if you look at a comparison, for example, of cases per 100,000, comparing that with Hawaii and the US, look at the rest of us. If we're looking at Pacific outbreaks, and this is actually from Dr. Angela Marianos' presentation at the WHO meeting held recently, since 2014, we've had 169 outbreaks across the Pacific region. And the highest prevalence were, of course, ILIs, dengue, Zika, chikungunya, some the arboviral outbreaks, and we're seeing that is becoming more frequent over time. And maybe as a result, our surveillance systems are getting better, so that may be that too. But at the same time, I think if we really do more studies, I think we're actually seeing, we're making much stronger case that it's actually a higher incidence and frequency of these over time. But there is progress. We are making some progress. We are really doing some good work. So it's not all doom and gloom. And then just to kind of highlight some things, particularly with regards to NCDs, back in 2010, nobody was really mapping any policy-related interventions for NCDs. Very few were actually doing adult surveys. And nobody was doing any NCD clinical care monitoring. Now, we're seeing it. So there is progress. It's just slow. And again, with this one here, with regards to NCDs, 10 years ago, a lot of these arrows were red. Now we're starting to see some greens, which is good, meaning that we're improving on addressing these. The zeros mean we're still kind of, haven't had any significant changes. And these dots here mean that we're still working on the data. But if we were to compare this dashboard with what was had 10 years ago, most of this was actually here. Most of that was no data, but we're getting there. We're slowly getting there. Same with communicable diseases and, for example, arboviral outbreaks. Marshall Islands and FSM and American Samoa now are able to do better communicable disease monitoring and actually setting up sit reps to be able to support good public health response. We didn't have this many years ago, so we're now seeing that. And so there is some improvement. We're getting some good data. Still, there's a lot of work to do. And just last but not least, I think what I wanted to highlight, particularly with climate change, there's been a lot of focus around Zika, dengue, chikungunya, sort of the arboviral diseases that we're seeing. And I just wanted to do a shout out for Guam Division of Environmental Health, who very recently were able to set up a mosquito lab in Dededo. And we're working with them through support through CDC and FDA to really strengthen that lab. And very recently, they've been able to now do a mosquito identification. And we're working with some of the islands now to be able to do routine collection of mosquitoes, send those mosquitoes to Guam for identification. And just a couple of weeks ago, they got their PCR machine. So now we can do pathogen testing as well for mosquitoes. So that's been a huge multi-year effort over the last how many years, Josie, to get to this point. So we're getting there. And we're hoping that in being able to have these capabilities available in the region, that we can really start moving the dial with regards to improving health outcomes overall in the islands. So I wanted to end with my last slide, and that is that our value that we put into this goes back to what we call the Healthy Islands vision. And this was developed back endorsed back in 1995, I believe it was, and re-emphasized just recently in, I believe, 2015. And that is that, we firmly believe that children should be nurtured in body and mind, that our environments invite learning and leisure, that our people work and age with dignity, that there is ecological balance, and that is a source of pride, and that the ocean that protects us is sustained. And that is really the core values that we, PIHOA, that guides the work that we're doing in the Pacific. So hopefully that'll give you a good sort of overview of what some of the issues that we're addressing. So thank you very much.